I'm Dr. Neil Skolnick, and today we're going to talk about the 2021 update on pre exposure prophylaxis for the prevention of HIV, or PrEP, a critically important topic for all of us to understand. So, joining us today to discuss this is Dr. Chris Bositis, who is a family physician and HIV specialist, who is also the clinical director of the National Clinician Consultation Center at UCSF, which runs the PrEP Warm Line. His clinical practice is currently in Greater Lawrence Family Health Center in Lawrence, Massachusetts. Chris, welcome to Medscape.
Thanks, Neil. Glad to be here.
Can we start by just defining what PrEP is and how well it works?
Sure. So PrEP, quite simply, is an HIV prevention method whereby somebody who does not have HIV takes a medication to reduce their risk of acquiring it if they're exposed to the virus. It's highly effective with efficacy estimates for reducing the risk of sexual transmission of HIV as high as 99%, and estimates around 74-75% for reducing the risk of HIV transmission through injection drug use.
And that degree of effectiveness is fantastic. Is it something that most of us in primary care should be able to prescribe?
Absolutely. The newest PrEP guidelines are really straightforward, and I think that PrEP prescribing is well within the scope of practice for all primary care clinicians.
If we're going to prescribe it, we need to think of it. Who is eligible?
A lot more people than we realize, with current estimates by the CDC indicating that as many as 1.2 million people in the US have some indication for PrEP use. Unfortunately, not everybody that could benefit is actually taking it, and PrEP rate use the rates of PrEP uptake are lowest for people of color, women, and those who inject drugs. So to try to address some of these inequities, the CDC recommends that clinicians talk to all sexually active adolescents and adults about PrEP, and that they prescribe it to anyone who requests it, even if no specific risk factors for HIV acquisition are identified. For people who report having vaginal or anal sex, PrEP should be offered if, one, they report having a sexual partner with HIV, particularly if that partner has a detectable HIV viral load, or if their viral load is not known. Two, if the person has been diagnosed with a bacterial STI in the last 6 months. Or three, if they report having one or more sexual partners whose HIV status is unknown, and they also report inconsistent or no condom use. And this third indication is really the broadest, and it's the one that's most underappreciated by most clinicians. For people who inject drugs, PrEP should be offered if they report an injection partner with HIV, sharing injection equipment, or any sexual risk factors for HIV acquisition as well.
So, Chris, this is really something that we should be thinking about pretty frequently. Can you go over the FDA approved medications for PrEP?
Sure, there are three. The first is commonly referred to as FTDF, or brand named Truvada. And this is an oral medication that is FDA approved for all adults and adolescents with any risk for HIV acquisition. It should not be used in people whose creatinine clearance is less than 60. And it also has a small and reversible risk for a decrease in bone mineral density. The second is commonly called FTAF, or brand name Descovy. This is basically a newer form of FTDF, which has a lower risk of bone and renal toxicity, but does have a slightly higher risk of weight gain and lipid abnormalities. And it is FDA approved for men and transgender women with sexual risk for HIV acquisition. And then lastly is Kabategravir, which is the newest FDA approved medication for PrEP. It's injectable, and it is approved for all adults and adolescents with any sexual risk for HIV acquisition.
How are the medicines dosed?
So the oral forms of PrEP, the FTDF and FTAF, are typically taken as one pill once a day. The FTDF, again, Truvada, is also approved for something called intermittent dosing in people who report less frequent sexual risk or sexual exposure to HIV. And for those folks, the dosing is called 211, where 2 pills of the FTDF are taken between 2 and 24 hours before the planned sexual activity, with one pill taken 24 hours after the first dose, and then one pill taken 24 hours after the second dose. For the injectable Kabategravir, the injections are monthly for the first 2 months, and then every 2 months thereafter.
Great. So we have a discussion with the patient. We decide with them that they want to start PrEP. Are there any labs we need to check before prescribing the medicines?
Yeah, absolutely. All people need to have baseline HIV testing before starting PrEP. In addition to that, hepatitis B testing and um, screening for syphilis should be done. Site-specific screening for gonorrhea and chlamydia is also recommended. And for people who will be taking oral PrEP, baseline renal function should be assessed with a creatinine.
So now we've prescribed the medicine. What is the recommended follow-up?
For people who are taking oral PrEP, it's recommended that HIV testing be repeated every 3 months, and that STI screening be repeated every 3 to 6 months. For renal function monitoring, that should be done with a serum creatinine at least yearly, and more often for people who are older or who have risk factors for progression to CKD. For people who are using the injectable form of PrEP, the HIV testing should be done at the time of each injection, and then the STI screening should be repeated every 2 to 4 months, according to the most recent guidelines.
Chris, this is incredibly helpful, and you've made it really something that we can implement in primary care. If our listeners have additional questions as they're thinking about this and seeing patients, what are the resources that are available for us?
The first resource that I would recommend is going to the CDC website. The PrEP guidelines are readily available there. But for folks who have questions about people that they're seeing in their clinical practice, I would also recommend calling us at the NCCC on the PrEP warm line. The number and URL for our website will be listed below, and we'd be happy to help you with any clinical questions that might arise.
That's so helpful. Dr. Chris Posidis, I appreciate your joining us today.
Thanks so much, Neil. It's been my pleasure to be here.
This is critically important information on a critically important topic. I'm Dr. Neil Skolnick, and this is Medscape.